If you've ever struggled with dental pain or missing teeth, you know it's about more than just the smile. It affects your confidence, your health, even the foods you can enjoy. Donald Toney went in and came in hoping to fix his teeth and left with a brand new smile and a few dance moves to match, all thanks to Dr. Michel Azer and the treatment at Texas Dental Implant Center. All right, this is why you love doing this, because you see how people's lives literally change when they can get that smile and that bite back.
Yeah, and immediately it's during the consultation visit, I can foresee what the change would be. I just want to have the patients see what I'm seeing. So we started doing this before and after mock-ups, where we show them what the future teeth are going to look like, and it gets a lot of patients motivated to do this treatment.
Yeah, we've talked about this several times before. The problem with teeth is that when there's a problem, the problem doesn't present itself right away. It sneaks up on us. Like we're thinking, oh, I brush, I'm good, right?
Yeah.
And then all of a sudden, by the time we're in pain, a lot of times problems don't present themselves with pain at first, but by the time we're in pain, that means that problem's been there for a minute.
For a long time.
Yeah.
By the time the patient is experiencing pain, that's where the infections have really broke through the mouth, and that's where it becomes really painful, and that's where they seek the attention.
Yeah. All right, Donald, as a kid, you had good teeth, and part of that was because your parents made you do what?
Go to the dentist.
Go to the dentist. All right, and then you grew up, you're out of your parents' house, and
slowly, just I'm okay, just.
Yeah, no need to go to the dentist. Your parents weren't making you go to the dentist
Right.
anymore. It wasn't your most fun place to go.
Right.
You say, right?
Terrified.
Okay, that's because as a kid you probably didn't have the dentist with the good treasure box. That's what happened right there. But what was the first indication for you that something was not right with your teeth?
The part where, just basically not chewing my food and just swallowing, just trying to, make by with it. And
You weren't chewing your food because it was painful, or you're afraid you're going to lose a tooth?
painful.
Okay.
Yeah, and teeth were getting loose, and just stomach always upset, and just.
As you mentioned, stomach always upset. Our teeth, our mouth, is tied to so many other parts of our body.
So the primary function of teeth is, of course, speaking and chewing. That's the functional part. But also when the mouth becomes so inflamed, it irritates the heart, it irritates the liver because of all that bacteria going in and out. And that's only one of the good benefits of getting your teeth checked or getting fixed.
Is to keep that bacteria at bay. Yeah.
Exactly.
All right, and periodontal disease, as we mentioned several times before, the majority of people have periodontal disease by their 30s and don't even know it.
They don't know it. It's like a silent disease. By the time you know it, it's already when the teeth become too loose and it's hurting you.
Yeah.
And that's why we like to check. By the time you're 30, you should be on a maintenance schedule to get yourself checked so that no problem all of a sudden arises.
Yeah, so we can outlive our teeth, right?
Yeah.
All right, so Londa, how did you see this impact your husband's self-confidence?
Oh, it greatly impacted his self-confidence. First thing, he loves food, so I noticed he was able to really eat and not become ill after he ate. It also helped his youthfulness. He had more smiling more.
Because before then, like enjoying a holiday meal would have been something that had been tough for him, right?
Right. So now he really enjoys being able to eat anything, and smile more.
Yeah, and Londa, let me ask y'all, how's the kissing?
Wonderful,
Great,
much better.
Oh, okay. Dr. Azer, every patient who comes into your office, a lot of times they've said they felt beaten up and they feel defeated. But one of the things that you do, you actually have made this a point in your office for everyone to be trained to have compassion and care when someone comes in. So people don't have to be afraid to come in to the dentist at your office. The other thing is not everybody's a simple one-size-fits-all fix. You literally drill down. I was going to use the word drill down. Of course, you're a dentist. Okay. But on how they got there, the best way to get out. Sometimes it's pulling all the teeth, but many times it's not. So it's everybody's an individual. So what was the procedure that you used on Donald?
So on Donald, I mean, like you said, the number one reason why people avoid going to the dentist is previous dental visits that didn't go right or was too painful. In our clinic, we've really find that process down to a one surgical visit, and that's the time where Donald came in to extract the teeth that he has, because it's all where had disease in it, and then we placed the implant on the same day. Now you can ask Donald. I mean, the procedure is very simple. He almost doesn't remember it even. Because we do sedation, and all our team are compassionate
I have
to
to say, you
overcome
did
that.
sedation to do a deep cleaning on my mouth, and I was like, oh, and all of a sudden I was like, well, you're done? Oh, it's all done?
Yeah,
Right?
it's
So it was
surprising
great,
by the time you're done. And then he gets in the next day to get the teeth, and I can remember Donald dancing in the front desk.
You
I
were
didn't see
dancing, were you, Donald?
But the
The
front
next
desk
day.
told me.
What was that moment like when you looked into the mirror? After how many years had you just been dealing with failed teeth?
You really want to know how many years?
Yeah.
Too long. Too many years.
Yeah, 2 years. Yeah.
But when I looked into the mirror, you know how most people start crying. I bust out laughing because I was so ready to smile.
Yeah. In fact, Londi say he smiles more than you do now.
Oh,
Yes.
yeah.
Yeah. And you mentioned some of the changes you see, that he can eat well now. He doesn't get the upset stomach anymore. The kissing's good. We got all that taken care of. But self-esteem and all those are all the things that are priceless. So what would both of you say to somebody who's been putting it off, because this is one of those things to put off, about getting in and finally getting that back?
Don't wait.
It's been a life-changing procedure for me. I feel better. My self-esteem is at an all-time high, and I suggest you go get it done as soon as possible, because
How do you feel about dentists now?
I actually go in his office now and jump in the chair.
Oh my
Yeah.
gosh. All right. So there's a lot of things that keep people away, Dr. Azer. Of course, they think, oh, I can't afford it. You don't want people to start there. Start with your health. Come in. You will work with people.
Correct. One of the things that we do in the consult visit is that you sit down with the treatment consultant, and then they're going to discuss with you the finances. I think that's part of the challenge of getting any dental treatment done, and they'll give you a lot of options to make this procedure affordable.
Yeah, and one of the reasons why it's more affordable in your office than perhaps some others is the fact that you have a lab right there on site. You're not sending it off site and waiting for it to come back, and you can get things done in a much shorter period of time, which also impacts the cost.
It's very time efficient. It's very cost efficient the way we have it. We cut down a lot of third-party expenses, and we pass these savings to our patients.
Yeah. All right, Donald. Okay, wait, come back on camera. Let's get back on camera. Show me the dance you did. Okay, you have to show me the dance you did, Donald. Show me
my dance?
Yeah, the dance, yeah.
I can do it?
You can do it. Yeah, show me the dance.
yeah.
Yeah, show me. The director wasn't expecting this, but there you go. Okay, that's the happy teeth dance right there. Okay. All right, the Texas Dental Implant Center has a special offer for Great Day viewers. The first 20 callers will receive a complimentary consultation with Dr. Azer and a free 3D scan after a pre-qualification call. Call now to schedule your appointment. The number to call is 346-1ARCH. That works out to be 346-663-2724. Again, 346-663-2724. 2724. To learn more about the Texas Dental Implant Center, visit bestdentalimplantshouston.com. Even if you've been told you don't have enough bone for implants, remember Dr. Azer handles severe cases as well.